healthcare reform for my patients, for other healthcare providers, and for my family. The way I see it, it is my professional and ethical responsibility to stand up for access to care for everyone, regardless of their economic status. Like so many other people out there, my personal experience has inspired me to make passing the Affordable Care Act a priority. My son was born with a heart defect. He had life-saving cardiac surgery, but it came at a great cost. Even between my health insurance and my husband's, we maxed out our policies to provide the care my son needed, and were left with huge out-of-pocket costs. Our families pitched in, but we never fully were able to afford what he needed. As a mother and as a nurse, my child not having what he needed, the care that he needed, was not an option. So we ended up putting heart catheterizations, echocardiograms, and doctor's visits on our credit cards. We always paid what we could, but those charges and mounting medical bills, after years and years, became more than we could ever repay in several lifetimes, so we had to file bankruptcy. Any mother out there can tell you that we never stopped worrying about our children. As my son grew and went on to college, he was about to lose his health insurance. Thankfully, all the hard work that we had put into passing the Affordable Care Act was a success, and it finally became law. I know I'm not the only parent who breathed a sigh of relief knowing that my son would not go without health insurance and the care that he needed, the preventative care. That still costs an awful lot. I know that now that the bridge to my health insurance is turning into the healthcare exchanges, where my son and millions of Americans like him will not have to live in fear and worry of either not having the health care they need or being bankrupt by medical bills. I'm very proud to tell you that in a year and a half, my son will be a nurse. As a union of nurses and healthcare workers in an era of the Affordable Care Act, funding for hospitals and providers will put our patients at the center, right where they ought to be. Of all the things that I do as a nurse and as a mother, making sure that the Affordable Care Act is fully implemented is the most important thing that I can do, and that we all can do. I'm determined that no family will ever have to go through what we did to have access to quality, affordable, and safe health care. Between now and the end of October, SEIU Healthcare Pennsylvania will recruit and train at least 500 members to be healthcare champions. As healthcare champions in our communities, we are going to share the facts about the Affordable Care Act with our friends, with our families, our neighbors, and in the facilities where we work and deliver care. We're going to make sure that the Affordable Care Act is fully implemented in Pennsylvania. That's why I'm proud that my union, the Union of Healthcare Workers, SEIU Healthcare Pennsylvania, has been an advocate for healthcare reform. At Allegheny General Hospital, nurses are driving the changes that need to be made to make sure that our patients are returned to health through our hospital-wide nurse-led quality teams. Every process and every step that we take is a move to make sure that you have the right care in the right place at the right time. And this fall, we've made a commitment to be involved, having our members out in the community, knocking on doors, engaging in public education and outreach to make sure that we can sign those who need it up on the healthcare exchanges. We have been sharing the facts about the Affordable Care Law with our coworkers, our friends, and our family, educating our coworkers to identify potentially eligible individuals that are in our churches, our civic groups, our universities, and our communities. All of our efforts will bring coverage to hundreds of thousands of Pennsylvanians, Pennsylvania workers, and those who need it. It will lower costs, and it will strengthen the work of nurses, physicians, and other healthcare providers to provide the highest quality of care for our patients. After all, that's what we want every day. Thank you.